When the COVID-19 pandemic hit Ontario, Pam Johnson made the decision to remove her mom from a long-term care facility and temporarily care for her in her own home until the pandemic was over. But Pam had to bring her back earlier than planned, or her mother would lose her room. Welcome, Pam. Let's go back to when you first heard the provincial emergency order allowing families to take their loved ones from long-term care. What did you do?
Yeah, it was such a chaotic time, April. It was, I certainly felt, I was making decision for myself and my household, what we needed to do to keep ourselves safe. But of course, my mom was in my mind. She lives in a long-term care facility. She's been there for 8.5 years. And certainly I was watching what was happening to older people living in China and older people in Italy and Spain. And then I saw what was happening in long-term care facilities in BC, and it was pretty terrifying. So many really sad stories, people not having the kind of support they needed to stay well or even alive. And failure to thrive. And so I spoke with my partner, and once he was laid off from work, we made the decision to bring my mom home to our home. So so it was a really big decision. Not many families that are in the same position we're in. I have training in caregiving. I was my mom's caregiver for many years, and we bought an accessible home so that my mom could come and stay with us. And I was working from home, and my partner was laid off. So we were in a very privileged position to be able to have her here.
There was an issue that happened along the way that you weren't aware of, and it ended up being a huge surprise and dilemma for you. Can you tell us a little bit more about that issue?
Yeah, sure. So, there's all of the emotional stuff that comes with making a decision like that, and of course, then turning your household a little upside down, because caregiving it's a 24/7 role, and my mother has advanced dementia, so she requires 24-hour support. What The home that she lives in, I definitely gave them the benefit of the doubt. We have a wonderful relationship with them, but they told us that if we continue paying for her room, she would have a secured room, like it would continue to be her room. And we found out, after sort of some back and forth and trying to plan for what her eventual return home would be, we found out that she actually had her room, she was discharged, and that should have apparently have happened the day that I picked her up. So the home didn't know that. They didn't inform themselves of that, and they didn't inform me of that. So what happens to families who take their loved ones out of long-term care right now is that they're supposed to be discharged the day that they leave the facility, which means then they get put on a priority listing or priority wait list to go back into that home. It doesn't guarantee when they can return or anything like that. So they lose their space effectively. With that, they also lose their doctor, and they lose any coverage, especially if they're a low-income senior. They lose any coverage for their medication. In some cases, homes are expecting families to come and get their things. They pack them up and move them out. So it's just a very different experience than what we were anticipating. So it was quite shocking and scary for us. My mom is a low-income senior as well, so no longer were her medications going to be covered by the province, and she was losing her doctor, and she's a vulnerable senior with some really complicated health issues.
So these issues have come out, and now this is extending to many families who had this happen to them. As you mentioned, it's scary, worrisome for both you and returning your mom back to the facility. What needs to be addressed now that this has come forward at this time?
Yeah. Well, I think what's really come to light, April, and I think for a lot of us who have loved ones who are living in long-term care are well aware of this, that it doesn't matter how good your long-term care facility is, how wonderful the staff is, how well trained they are. The reality is that 10-to-1 care is not adequate care. Having one person have to attend to 10 or more people on their shift is not good care. And as a public institutions are doing this, or even private institutions are doing this, we're not giving our parents and our loved ones, our spouses, our friends, the kind of care and dignity that they deserve. In, in addition to this is that, you know, the spread of disease happens very quickly when you have one caregiver having to attend to 10 different people within, you know, one shift, and multiple times they're doing very intimate care. So it's very hard, even if you're doing all of those protocols for universal precautions, it's really hard to make sure that you keep people safe and healthy. So it's tremendous amount of pressure on those caregivers, on top of which a lot of these older homes that are really outdated are having people they have to live in ward rooms, is what they're called. So basically like up to 4 people in a room. So having anybody sick in that kind of space, we know that COVID-19 is highly contagious. The likeliness that other people in that room will get sick is very high. And so it highlights the fact that our system is far underfunded. It's really outdated, and that if we want to treat our loved ones with the dignity and the respect that they deserve, we really need to completely reform the system.
So your mom is back home now. Are you feeling that you need to advocate even more stronger than you have before, now that she's back, in order to feel that at least you are comfortable with making that decision to have returned her home?
Yeah, I mean, absolutely, April. You, as a caregiver, you never stop advocating for your family member. There are times when you get to have a bit of a breather, especially if they're living in a good home and they've got good caregivers. You can just take a bit of a breath and you can be their loved one rather than constantly their caregiver advocate. However, I think the advocacy has changed. While it's constantly there with the home and other caregivers, but you're kind of a team. Where I think a lot of our focus has shifted is now more so with the government and reform. So that is where the advocacy really, that energy needs to go, is to make sure that you're collectively coming together with other families to fight for change and try to get everybody to understand that, you know, this social welfare system is not supporting our family members the way it should be. And so we need to make sure that as Ontarians, we need to support that system and be able to know that we have to do that with our votes and with our pocketbooks. It likely means increases in taxes, but in the end, we're all going to be in that position one day where we require that kind of care. And so are we willing to invest in really making those changes now?
Whereabouts are you at with the government in terms of, since these issues have come forward, do you feel like you're making some headway at this point?
Like on a personal level, not as much. I certainly took forward my concerns to the patient ombudsperson for Ontario. I spoke with the action line for the long-term care in Ontario. I spoke with my MPP. I know there's higher level advocacy that's happening, and there's significantly, you know, there's huge numbers of advocacy groups that are coming together in ways that they never had before, in great volume, families and children of people in long-term care. And so I think that they are making progress. Certainly people have probably heard about some class action suits that are being brought against some of the homes that have like actually demonstrated, or they're alleged to demonstrate negligence towards the with respect to the care of these folks. So I think that we're making strides forward, but we have to keep pushing.
Pam, what if there's a second wave? What will you do then?
Yeah, I think, you know, I think that that's a lingering fear for a lot of us. So my mom, we were lucky enough to have her return back to her long-term care home as I'm moving out of working from home to back into like physically being in my work. And so I guess the reality for me as her daughter is that if there is a second wave and we're seeing cases rise again, especially long-term care, I will want to take her out again. What that means for our family, I have no idea. We almost lost my mom's housing, and that was just because I wanted to keep her safe and take some of the burden off her caregivers. So I have to continue to work with the local LIN and the LIN in her area, as well with the other functions of government, to try and figure out a plan. But I'm really hoping that now that we have a bit more time and information, we can make really thoughtful plans for people to be able to do this again.
Because of this issue, are you hearing from more folks that have had the same issue so that you're building that capacity to do so with the government?
Absolutely. I really encourage any families who've been through this, or you're considering it, or you're concerned about your family members, get onto social media. There are lots of really wonderful and reputable groups that have come together. Speak to your MPPs, speak to your local LINs, try to get yourself informed. Again, I think the best way for us to inform each other and to be able to move this forward and see progress is to band together and work together to see change. And so I've met a tremendous number of families through sharing our story, and they've become wonderful extensions of our social network. And they've been great supporters. They know what we're going through, and some of their situations are just atrocious. They're heartbreaking stories.
Pam, I'd like to thank you for joining us today, and I appreciate hearing about the work that you are doing. I'm also happy to hear that your mom is back home and things are going well. Thanks again, Pam.
Yeah, thanks so much, April. I really appreciate taking the time.
Thank you.